tell me about one facial area that you saw that was done elsewhere that you feel like was overfilled.
All right, one area, jawline filler. Here's the thing. If you can't see your jawline to start, and there's so much laxity that it's kind of just hidden, and there's a lot of neck laxity, I don't think jawline filler is going to give you a jawline. It probably needs to be rejuvenated another way, and one consistent way that you can get a nice result is a deep plane facelift and neck lift. But that is an area that can create heaviness if it's just over-injected.
Yeah, I think if you put a significant amount of filler, I agree with you, in the soft tissue here, with the goal of creating a shadow, it will not be an enhancement. I still think you can do subtle little touches to suggest definition with filler.
Well, improving like the chin.
Sure, yeah, some structural enhancement, but I agree, if someone's flooding multiple syringes to create a bone structure where there really isn't any, it's not going to serve that visual.
Second area where you look at and say, this is an area that maybe is over-injected.
The junction between the eyelid and the cheek. It's just, no matter how much progress we make as a field, improving our injection techniques there, it is an area where people seek perfection in terms of filler, and that is always a recipe for trouble. When you are doing a session of filler and you get a perfect correction where it looks as smooth as can be, 2, 4, 6, 8 months, 12 months, 2 years down the line, you can have some changes that you weren't expected. Water draw, migration superficially, visibility of the filler, bluish discoloration, where it can really distort things and look filled, even when it didn't at the time of treatment.
Yep, and then anatomically, usually those patients that are harder to fill have a low orbital rim, wide orbital socket, as opposed to the easier patients to fill, we get a nicer result, might have high orbital rims.